I'm here with Bruce Alan, our morning anchor, who is joining us this week after a very long recovery from COVID. And we are glad to see his face and hopefully soon see him on the air. Good to see you.
Good to be seen and good to see you.
Where you been?
COVIDing?
First of all, I mean, not to make light of it, because you've been through hell and back, it sounds like.
Feels like it.
When did everything start for you? Because it's, we've missed you on the air. It's been a while since you came back earlier this week, but it was, what, 6 weeks?
2 months. Actually, as much as I feel like I have been through hell, there are people who are much worse off than me with this thing, and I'm just thinking about them gives me anxiety. So I have perspective on where I fell on the scale, but yeah, it wasn't easy. It started like around, I was on vacation the end of the year. So the last week of December, I was off already. And then New Year's Day, I started feeling sick. But it was like normal sickness. It was like a normal virus like we all get 1,000 times in our lifetimes. And I still think it may have been a normal virus at that time. But I had a low-grade fever. It's really the only symptom, and some aches and pains, but I couldn't come to work that week.
Mm-hmm. So you're thinking it's just a cold, and
right.
But of course, at the same time, I'm sure you're a little concerned just given the times we live in, right? I mean,
well, I did get a COVID test the day after New Year's just because I was feeling crappy, and you got to go get a test. So I got a test, a PCR test, that came back a few days later negative. Okay, so I still couldn't come into work because of the low-grade fever. I ended up being off all that week, and then Friday, and I had told Darcy, our news director, on Thursday, feels a little different today, but still can't come in. Friday afternoon, I started going downhill pretty quickly, and I went for another test. I went to urgent care Saturday morning. They did a rapid test, which came back negative, but they also, the rapid test is a little unreliable, so they did a PCR test and sent that off. Mm-hmm. They diagnosed bronchitis and sent me home. 2 days later, I get a call that PCR test is positive.
Were you continually going downhill, or did you feel like, it's probably just bronchitis and I have a bad
No, I was still
strain?
going downhill, and some of that realization is in hindsight. I mean, I just wasn't thinking clearly because there were so many signs that I was way more seriously ill than I was imagining.
Well, I'm sure you didn't want it to be true either.
I ignored them all. Right. I actually, when the phone call came to say it was positive, I was like, no, I just
You're wrong.
I just had a rapid test and I had a PCR test a week ago. That was all negative. So could this be a mistake? Nope. Anyway, yeah, things were going downhill, and there were a couple of signs that I was more seriously ill than I thought. And it didn't even register with me that I'm not thinking clearly. Like I had a light Afghan at the foot of the bed, and I was looking to bring that into the living room. It was too heavy for me. I mean, it weighs as much as like a pair of pants or something. It's nothing. I just could not bring it in.
Was that an energy thing, or was that you just didn't have the energy?
Strength, anything. I don't know what it was. I just couldn't do it. That should have been enough alone, but then I had tried all these over-the-counter medications, not from the week before, just like for when I started going downhill. And none of them worked. They were all over the place. Kitchen counter, bathroom counter. And I wasn't sleeping really well. I was sleeping for a very long time, but I wasn't that tired. I mean, you sleep for 11 hours. People have different sleeping habits. I don't sleep for 11 hours unless something's really wrong.
Right.
So I slept for 11 hours one night, slept for 11 hours the next night.
Wow.
And it just didn't really register. Maybe something else is going on here.
Right. But then you had sort of the wake-up call moment.
Well, when the test came back positive, even after that, I still was like, I'm fine. And then I went to lie down Tuesday evening. Even though I wasn't going to work, I was still going to bed pretty early.
Yeah.
And I just could not breathe. I couldn't stay lying down. Sitting up, I also felt like I had trouble catching my breath, but I was at least okay. I could breathe. So I'm telling this to my daughter, who's a nurse, and my girlfriend, and they're both telling me, you got to call 911 now. And I was like, nah, I'll be okay. And I'm not usually like that. I don't avoid doctors or medical care. I have a need, I go. But for some reason, I was just resisting calling 911. Ultimately, I did, and it's a good thing I did. I was in worse shape than I realized. They gave me oxygen in the ambulance. It was a short ambulance ride, but your blood oxygen level should be like 94 or higher. And when I got to the hospital, even after being on oxygen in the ambulance, I was in the 70s.
Wow.
So in hindsight, I realized how bad it was. I didn't feel that bad at the moment, though. So I get to the emergency room, and they put me in one of these, it's all like compartmentalized, like little glass compartments. I didn't ask anybody, but I suppose in the age of COVID, the little cloth partitions don't cut it anymore.
Yeah, right.
So they put me on oxygen, and over the next, 8 hours in the ER, they sent me for a chest x-ray, a chest CT scan, and then they admitted me.
So at that point, I mean, I know it's hard to kind of stop time as you're going through this, but at that point, are you thinking, oh my God, I mean, did you have any feeling that this is going to get worse, or did you think, okay, I'm here, it'll get better? How were you feeling at that point?
I was breathing okay, so I felt okay. I didn't have any other symptoms, I guess weakness, but I wasn't doing anything, so it wasn't an issue.
Right.
And I felt like, okay, I'm here, I'm in good hands, and I'm not like, I don't feel like I'm dying. And I felt like I was in good hands, and I ended up getting great care where I was. But no, I never felt like this is really going to go south and I'm in trouble. I mean, I knew I was in some trouble, but I felt like I was manageable, and it turned out I was.
And very rarely have we heard the story of what it's like inside the hospital from anybody, which I think is a really interesting part of your story, because it's a lot of loneliness, it sounds like.
Well, that took me by surprise, because, the old stereotypical hospital stay, they wake you up every 2 hours, you can't sleep, they want to take your vitals or take blood or whatever.
They won't leave you alone because they want to check on you.
They left me alone this time. It was, I wasn't in the ICU or anything. Yeah. I didn't have to be on a ventilator, but it's still an isolation unit. And not only are you isolated from other patients, but the staff is not looking to come in and hang out with you. So they do what they have to do, sometimes in bunches, and then you're left alone for a long time. And that isolation, the loneliness, is something to deal with. And I actually wondered at one point, just a few days in, are they paying enough attention to me? Of course they were. And then I had a very good day, like 4 days in or so. I felt like I wasn't sick at all. And they did this little test with me where they take you off the oxygen, so it's just room air now. And they want to see how long. Yeah, the cough is a little issue too. It's mostly gone.
I was gonna say, is it hard to sustain talking for a while?
I'm finding out now.
Yeah.
But it's not as hard as I thought. The cough has mostly gone away. Still there a little bit, but mostly gone away. Anyway, so I was feeling great that day, and they did this little test. I'm in room air now, and I'm walking around the room. Can't go out in the hallway because it's an isolation unit. So I'm walking back and forth in the room with the nurse and having a conversation. And after like 5 minutes, they check your blood oxygen levels, and mine were fine on room air. So I'm getting cocky now. Yeah. I licked this thing in 4 days or whatever. And then the next day, my heart went a little kablooey. Rapid heart rate, developed atrial fibrillation. Now they told me that it's not unusual, that sometimes it's just from the shock of your body dealing with the virus, and it could go away and never come back again. And gratefully, that's exactly what happened.
Wow.
I had a bunch of EKGs that day, and then they treated the atrial fibrillation with a drip of metoprolol, and then it went away, thankfully.
So you went in on the 2nd? Went in on the 1st?
No, went in on the 12th.
Oh, wow.
Well, I had that week of what I thought was a normal virus,
Okay.
From New Year's Day to, to like the Saturday the 9th, I think. And that's when I was at urgent care getting my second COVID test. I came back positive.
Okay.
But even when it comes back positive, you don't just automatically go to the hospital.
Right.
I know several people who've had like the mild version of COVID. That's the one I wanted. I didn't get it, but that's what I wanted.
But it is pretty wild how it hits people differently. I mean,
well, on that day that my heart went crazy, I got a lot of attention that day. And I decided I'm not going to really wonder if I'm getting enough attention anymore, because it turns out they're slammed every day by various patients. You know, if you're not the one needing the attention, you're not getting it, and that turned out to be okay by me. The one day that I was the guy who needed the attention, I was happy to be done with that day, and you can leave me alone, that's fine. I can handle it.
how long were you in the hospital for total?
12 days. I've been in the hospital before for like 2 or 3 days, but that was a long stay.
Yeah.
It's a long time to go from the bed to the chair and the chair to the bed. There's nothing else.
Right, because you said you were basically stuck in the room. You couldn't
Right.
walk the hallways.
Right.
So you're just sort of pacing, don't really want to watch too much TV. I mean, it's a whole
Right.
sort of like exercise in, you know, your mentality, I guess.
And then
while you're in
sometimes I'd
there.
wake up really early.
Yeah.
Well, I don't want to make the move to the chair then, because then it's a 14-hour deal in the chair.
So you're like planning out your day.
Right.
Oh man. What did you think was going to be? I mean, okay, so you're diagnosed with COVID. At that point, you're feeling okay, not as sick as you got.
Yeah, they diagnosed acute COVID-related pneumonia and hypoxia. And hypoxia is when the organs aren't getting enough oxygen. And I guess that was my situation at first. Gratefully, that didn't turn out to be an issue, because I got oxygen pretty quickly.
I think what's interesting about your perspective, beyond the fact that you've come through this and you're recovering now, is you came to work every day. I mean, most people were working from home. You were here covering this story every day, and then you become part of the story. Did you have a preconceived notion or something that you thought was going to be challenging that then ended up being something else? Or what did you think was going to be the most challenging part of this, and what ended up being the most challenging part?
I didn't really have any preconceived notions. I mean, we had stories of people who had hardly any symptoms at all, and people who were in terrible shape on ventilators and stuff. So
Right.
I kind of knew I was somewhere in between. There was one day we had a guy who worked in the ICU come up, and he was helping out on our unit where I was. And he started to tell me some stories from the ICU, and I was like, don't tell me anymore. I don't want to hear this. I mean, they were bad stories.
Yeah.
People had it a lot worse than I did. So.
It gave you perspective then.
Right. I still wasn't thrilled that I didn't get the light version, which is the one I wanted, but
Next time.
could have been a lot worse.
Wow. Are there things, so pulling back a minute, you and I have known each other for a long time, and we've seen each other through different health things. You've had surgery before, and I mean recently, like in the last
3 years.
3 years. And you were saying that kind of has come back up to the front. But I think that my question is, it makes you appreciate your health when you come out on the other side of it. And is there something now, I mean, do you try and take deep breaths? Is there something that you are seeing now more clearly or appreciate more than?
Yeah, I do take more deep breaths, I feel like, than I used to. Sometimes just testing to see if I can and that it feels okay. I had a hip surgery 3 years ago. For whatever reason, COVID targeted that. It's just a weak spot, I guess. So I had to go back to the hip surgeon to make sure there was no damage to the joint. And
Wow.
And I mean, my PT and the other doctors all wanted to know, is there anything wrong with the joint? Turns out there wasn't, but still, I feel like I'm recovering all over again.
Which sort of jives with what people have said, like I had this thing that would bother me before, this pre-existing condition, and that got worse. But it's
Right.
interesting that a surgery.
I still don't understand it, but that's like the hardest part now, is what's affecting me from that surgery from 3 years ago. Because most everything else I feel like is gone. I'm off oxygen. I can take deep breaths. I mean, I can talk for a fair amount of time. I have no stamina. I still have to build up my stamina. I started last week, or as we're recording it this week, with half days. And the first day, I went home. I was out in a chair for 2 hours.
So I think people will be interested to hear why you're not on the air, because you have to build up that endurance, essentially.
That's exactly it. I need to build up stamina in my body and my voice. I mean, my voice gets tired after a couple of hours now. I mean, I'm doing stuff, I'm doing reports for on air, so hopefully, and I'm using my voice more, so hopefully that'll come. But yeah, I want my stamina back. I hope it comes back fast. Nothing else has happened fast in this.
Everything's a slow process.
Yeah, I'll say.
There were a lot of big stories that happened when you were gone.
I watched most of them in the hospital.
I was going to say, well, and when you're removed from it as a news person, I mean, I'm sure you were chomping at the bit, but you were in such a compromised state. I mean, was it difficult to be away from the news business?
Well, I had things I wanted to say and for coverage, but
yeah.
Nobody heard me. Nobody was in the room.
So you were just, anchoring in your
I was just doing commentary in the room for myself. But yeah, that was frustrating.
What do you think is the biggest thing that you want people to know about your story, to share?
I mean, in the age of a pandemic, you just take everything seriously. Don't poo-poo it. Go get a test if you need to get a test. If you have any concern, get tested and find out. But even some of the other things that happened along the way, that day that my heart went kaflooey, okay, now I got a cardiologist in the hospital. And then in the CT scan, it was like, is that a clot or is it just like a shadow? And the doctors couldn't actually determine whether it was real or not. But it's COVID, so we take it seriously. So that just meant a medication for me. But now I have a hematologist too.
Wow. I mean, you're a very happy-go-lucky guy, and we've known each other for a while, so we're kind of joking around about this, but it was really serious, and the fact that you said if you hadn't called 911, that may have been a very different scenario.
Yeah, I don't think I would have made it through the night when I was home. So, but it got so bad that I realized I do need to call 911. That combined with other people telling me, you're an idiot if you don't call 911. And the days that this stuff was going on with my heart and the CT scan and the possible clot, those were not fun days.
Glad it's behind
not that
you.
the others were so much fun either, but they were not my best days there. The only thing I had to do, there are only two things you can do to help yourself, I was told, as a COVID patient. Proning, which I'll explain, and the spirometer, which I think everybody has probably had in a hospital, where you inhale and the float, you got to keep the floaties up as you take the big breath in. So you do that. Proning is basically, in my case, it was just lying on my stomach. But for patients who are on a ventilator and have to be moved gradually, there's a whole process for it. But the idea is that it opens up parts of your lungs that aren't open. You're in bed on your back, you're in the chair, you're leaning back. Get some of that mucus off the back of your lungs, open up other areas of your lungs. So you basically lie on your stomach with a pillow under your torso and take deep breaths. That's what I was doing. Occasionally falling asleep. I don't know. I'm not sure that helped.
Couldn't hurt. Well, we are glad that you are back.
Sorry.
It's okay.
I am so happy to be back. Can't wait till I have my stamina back and I'm back doing mornings again.